you. The next question, the member for London North Centre.
Good morning, Speaker. My question is to the Premier. MPPs across the province have been hearing from constituents about the unmitigated crisis in our hospitals. But are Conservative MPPs truly listening? My constituent Colleen told me about her mother's ER experience, and I quote, "My brilliant, independent, selfless, always helping others mom had to hope and pray for someone to walk down that hall to attempt to get help." Her oxygen machine was empty. When Colleen brought this to the hospital's attention, the nurses' overwhelmed exhaustion was clear. It wasn't their fault, Speaker. Will this government keep blaming others, keep neglecting public health care, or fund it properly and pay nurses what they're worth?
Right on.
Member for Eglinton Lawrence, Parliamentary School.
Thank you very much, Mr. Speaker. And after decades of underfunding, it is this government that has made unprecedented investments in our healthcare system. As I said yesterday, healthcare funding has increased a record 6.2% year over year, the largest increase on record, including an over $5 billion increase in base funding, which is an 8.9% increase. A lot of these investments are because we've just gone through a very difficult time for the healthcare system. As everybody knows, the pandemic has been happening for 2 years. And that is why we passed a plan to stay open, because you want to stay open. The pandemic had shut everybody down for a while, and we want to make sure we stay open. And that plan has 5 important initiatives to, once fully implemented, help our healthcare system get back on track. We've added up to 6,000 more healthcare workers after that plan is instituted, but you know we've already added 11,700 healthcare workers since the pandemic began. But our plan also frees up over 2,500 new hospital beds and expands models of care. We're going to continue working for the people of Ontario in finding solutions to make our healthcare system better.
The supplementary question.
Speaker, I guess part of my question was answered. They will continue to blame others. Look, this Conservative Party is the party of furniture, whereas we are the party with the NDP of the front lines. They're the party of healthcare profiteers, whereas we're the party of the working people. For years, the Liberal Party cut and underfunded the way for hallway medicine. It's only degraded further since this Conservative government started their callous evisceration of our public healthcare system. They have not fixed it. It's gotten worse. Just last week, LHSC in London posted a 20-hour delay for their ER and asked patients to bring a snack and activities. My constituent Tina told me about searching in vain for a nurse or doctor after her partner's Rod's major surgery. No doctors were available, and nurses were run off their feet. Tina waited for days until she finally got a phone call. The RNNO surveyed nurses and found that 69% are planning on leaving the profession in the next 5 years. When will this government admit they've created a crisis and spend money on frontline healthcare heroes?
Right on.